I'm amazed that people can maintain relationships during medical school and residency. The first couple of years of medical school are not that bad for relationships, in my opinion. As long as your partner understands that you're really going to be busy and studying a lot, it's generally doable. But once clinical rotations start in third year, all bets are off. I remember I did my surgery rotation in the beginning of third year, and I think it was for 2 or 3 months. It was a pretty long rotation, and I think that's the closest I ever got to breaking off my engagement. And to be clear, it's not that I wanted to break it off, it's just that my fiance thought that I turned into a really, really mean person during my surgery rotation. Thinking back, it was this horrible combination of being super sleep deprived under a lot of stress and also just being in this environment where it was not prized to show any emotion. So I just became this emotionless robot med student for about 3 months until my fiance told me to stop it. By the time I got to urology residency later on, I had internalized that it was going to be hard, but I didn't want it to change who I was. I didn't want it to change my personality or the way that I related to my loved ones. Now, this definitely created some problems for me, and there were clashes of personality between me and some of the other residents, but it is what it is. So if you're in med school or residency and you're in a relationship, just remember, don't let what you're doing in the hospital or on rotations change who you are, or worse, affect the quality of your relationships with your loved ones. I'm Dan the Doranian Doctor, urologic surgeon and founder of Sirius Real Estate. Follow for more.